Here is more scary information about what SARS Cov2 does to the brain of the victims. Research at the University of California has revealed that the COVID affliction leads to a host of psychological and neurological symptoms, starting with anosmia or loss of sense of smell. Headache, confusion, hallucination, delirium, sometimes depression, anxiety, and sleep problems. Now, the scientists at the University of California were wondering, how does the SARS-CoV-2 virus cause these effects? They discovered that the virus travels up the olfactory nerve, causing anosmia as one of the early symptoms of COVID-19 infection. Now, once it reaches the brain, what it does is it leads to leakage of the blood vessels of the brain. So, in victims of COVID-19, during the postmortem, a very high resonance MRI scan was used, which can't be used in living patients because of its dangerously high levels of magnetic resonance. So these images reveal that there is almost always leakage of the blood vessels. In fact, 1/3 of the victims of COVID-19 show the signs of different psychological signs, as discussed earlier. Now, the postmortem studies of COVID-19 victims found the blood vessels thick, inflamed, clogged, and leaking. Biochemical analysis showed that the serotonin, norepinephrine, dopamine communication mediators are scrambled, kind of all mixed up, leading to disruption of the communication channel. They also found microglia. These are the brain's equivalent of body's immune response. So there's a lot of microglia primed action in the brain of victims of COVID-19. So put together, COVID-19 is going to have a serious psychological or neurological long-term impact on its victims. Of course, the neurological impact, as we all know, are brain bleeds and strokes and things like that. So let's not take asymptomatic and mild cases of the COVID-19 lightly, because it's likely to lead to long-term effects on the brain, which could be sometimes irreversible. But the reversibility of these brain psychological symptoms, there's no clear study available because it's too early to say anything. However, it seems extremely likely that many of these symptoms could be irreversible. So, point the finger at the long-term deleterious impact of the SARS-CoV-2 virus on the system. Thank you very much.